What is the average cost of a Medicare supplement plan? People are always watching costs, and you should be, because the cost of gas is going up, the cost of groceries are going up, and a lot of times people don't even know what the heck they're paying for. They don't know what the cost of their Medicare supplement plan is. And when they come to me to look at Medicare plans, they just want to know they're getting a fair deal. They want to know, are they paying the right price? They're shopping around a little bit and they're looking at things. So what is the average cost? Now remember, average is a really big word, because Medicare supplement plans, there's nothing really average about them, although they are standardized. Remember, a Medicare supplement plan, also called Medigap, is a standardized plan. Most people have Plan F, Plan G, Plan N, most popular plans. These plans are standardized by the federal government. Every F plan is the same, every G plan is the same, every N plan is the same, but the price could be different. The price on these plans is based on your age, whether you're a man or a woman, where you live, so geography matters. But to just cut to the chase, the average cost of a Medicare Supplement Plan G is somewhere between $100 to $150 a month. Now that is an average. If you're in some higher cost areas, the Northeast versus the South versus Middle America, you may be paying something entirely different. Okay, certain states have different ways of pricing it, but the average cost is somewhere around $100 to $150 a month for a Plan G for someone age 65 going on to Medicare for the first time. The Plan N, which is also very popular, is going to be about $40 or so lower. It's going to be somewhere between $80 and $120. Okay, so the Plan N is going to be a little bit lower than the Plan G because, remember, Plan N has that copay, right? So the Plan G, which is the Cadillac plan, is going to cover your hospital Part A 100%, and your Part B, you have that once a year deductible, that $300 or so deductible that Medicare sets each year. You're on the hook for that with the Plan G, and then you have no copays. The Plan N, you have the copay, $20 for office visits and $50 for emergency room visit. So why do the prices vary so much with Medicare supplement plans? Well, as I mentioned, it is an average, and across the country, people are paying a different price tag. The insurance companies can set the price. It's not a standardized price tag, it's a standardized coverage. So although Plan G is the same across the whole United States, the coverage that is, the price tag is different. The price can vary based on where you live, zip code. So in the state of New Jersey, you're going to pay more than you're paying in the state of Pennsylvania or in the state of Alabama. In the state of New York is the biggest price tag. You're going to pay something entirely different because the insurance companies use a pricing methodology which is set by the state that you live in. So your zip code matters. Most states use what's called attained age pricing. That means as you get older, the price goes up. So that is a factor. Where you live, that's important. Your zip code. Some states that are big, like the state of Pennsylvania, the price will vary based on where you live. Okay, so remember, we're talking about averages. So what does the insurance company use to price the product? They look at your age. They also look at your sex. They look if you're a man or a woman. Guess what? Women pay less than men typically because we live longer. It's an underwriting thing. Just like life insurance, we live longer, ladies live longer, we pay less. So the insurance company thinks that you're going to pay your premium over a longer period of time, so you'll pay a little less. Now, some insurance companies offer discounts when two people in a household, a couple, partners, roommates, you may get a discount on your price for your Medicare supplement plan. So that's a pretty big thing for some folks. Some states don't even offer that. Some insurance companies don't offer that. But your price is based on your zip code, whether you're a man or a woman, and it can vary if you have a a partner, a significant other that you live with, you may qualify for that discount. So the other thing that matters, are you a tobacco user? Tobacco users pay more, right? Just like a life insurance policy, if you had a life insurance policy, you're gonna pay more for your life insurance because your life expectancy is lower. If you're a tobacco user, you likely will have more medical issues than somebody who's not. So the insurance company is going to rate you or charge you more if you're a tobacco user. Finally, one of the biggest things that affects the price of a Medicare supplement plan is the insurance company itself. So just because you buy a plan G doesn't mean the price is exactly the same from company XYZ to company ABC. The price can vary based on the insurance company. And a lot of times people will say, okay, I know this company and I'm gonna buy my insurance from them, which is fine, but the insurance company reserves the right to price the plan how they want to. So it's important to know that the insurance company is in control of the pricing. So what is the average cost of a Medicare supplement plan? Well, that can vary throughout the country. And again, the most popular plans are G and N. F is no longer available. But we shouldn't always go by the average cost. You want to make sure you're paying a fair price. They're going to look at your age, whether you're a man or a woman, where you live, whether you use tobacco, and then the insurance company sets the price. So if you're looking at, am I paying too much for this plan? You should shop around. You should take a look at what's available. You should get a quote every once in a while on your Medicare supplement plan to make sure you're getting a fair price. Don't assume that you're paying the highest rate or the lowest rate. You always want to check that. Medicare doesn't give you the price of insurance. You'd have to go through the insurance company themselves or a broker, somebody who has access to multiple different companies. And you want to make sure you're checking your price every once in a while. You do have to go through underwriting if you want to change your plan, change your company. We have a great video on Medicare supplements and underwriting. We also have some videos on when you can switch your plan and that sort of thing. If you're looking for more information, go ahead and click on some of the other videos that are listed here for you. You can also click on our video, Can I Change My Medicare Supplement Plan at Any Time? In that video in particular, we offer you a free report. 7 questions every baby boomer needs to ask before going on Medicare. It is loaded with great information about Medicare in general. So you want to click on that so you can take advantage of that free report and get all your Medicare questions answered just by looking at the report.